I'm not going to stand here and bore you with dry stats and graphs about the importance of cancer. We're all familiar with cancer. The majority of us have either experienced it firsthand or know someone close to us who has. Instead, I'm going to talk to you about how we're looking to improve drugs used in the fight against cancer. Now, the drug development process is an extremely rigorous process. The odds of getting a potential drug from conception to preclinical trials, clinical trials, and then to market are staggering. Now, while this process is necessary, it's also financially very costly and also time-consuming. After this process, we may like to think that the resulting drug is near perfect, a metaphoric knight in shining armour up there that will ride into our bodies, find and destroy the cancer cells, and then ride off into the sunset, leaving our body without interfering with our healthy cells. This is not the case. Anti-cancer drugs tend to act like thugs when administered into the body. Most anti-cancer drugs can't distinguish between healthy cells and cancerous cells, and so as they spread throughout the body, they interfere and indiscriminately kill whichever cell they happen to enter. It's this lack of discrimination between cancerous cells and healthy cells that leads to the debilitating side effects observed in patients undergoing chemotherapy. I'd like to share with you how we're aiming to improve the efficiency of these anti-cancer drugs. What if we could lock up our anti-cancer thug of a drug within a molecular cage? This would not only protect our cells, our healthy cells, from the drug's toxicity, but it would also stabilise our anti-cancer drug from our body's own natural defences and stop it being prematurely broken down. Furthermore, instead of chemically spending time and money to chemically alter the anti-cancer drug, we could instead alter the external surface of our molecular cage with a tumour targeting mechanism, represented here by a cartoon of a truck and a GPS satellite. But in reality, it would be an antibody or protein that would exclusively bind to a receptor that's unique or overexpressed in cancer cells. Once the cage and the drug have arrived at the tumour, it could then be released either by chemical stimulus from the tumour itself or by external stimulus such as radiation, as it's in such close proximity to the cancer cells, be free to kill these cells before being broken down and excreted by our body. We hope by using this process to turn our thug of an anti-cancer drug into its potential as a knight in shining armour. We've shown that our molecular cage can encapsulate the common anti-cancer drug cisplatin. We've also shown that once encapsulated, the toxicity of the drug is severely reduced in healthy tissue, but is still prevalent in cancer cells. Furthermore, we've attached a short targeting peptide to the outside of our molecular cage, and we're working on increasing the solubility and studying the encapsulation process in physiological conditions so we can further understand our cage and improve it. Thank you.